The human brain has nearly perfected the art of efficiency. It controls every conscious and unconscious movement, reacting with unbelievable speed, all while sloshing around in cerebrospinal fluid. The fluid provides some cushion to avoid injury and provides essential nutrients to the central nervous system. Unfortunately, it can start to build up in parts of the brain and increase pressure, which Dr. Matthew Potts says creates a dangerous situation.
Reasons for that fluid building up can include trauma, can include infection, bleeding in the brain. Sometimes tumors can allow that fluid to build up.
Potts is a neurosurgeon and associate professor of neurological surgery at Northwestern Feinberg School of Medicine. He says that in order to either drain the excess fluid or continue to monitor the pressure, he first has to drill a hole into the patient's skull.
Oftentimes, this is done in an emergency. These are patients who are rapidly declining, where we want to treat them as fast as possible. And so oftentimes this is not done in the operating room, but it's done in the intensive care unit at the bedside.
The process begins by shaving the patient's head to expose the scalp where the drain needs to enter. Potts says it's typically done in the frontal region on the right side of the brain.
It's in an area that doesn't control movement, doesn't control sensation, doesn't control language, doesn't control memory. It's probably the safest place we could place a drain or a pressure monitor. So we mark that spot based on landmarks on the scalp and the face. And so we make a very small incision. It's usually about an inch in the scalp. And that gets us down to the bone, the skull. So then we take our drain or our pressure monitor and we pass that through into the ventricles for a drain or just into the substance of the brain itself, that right frontal lobe, for a pressure monitor.
If the pressure is high enough, the fluid will immediately start coming out of the drain. When this procedure has to be done in an emergency, Potts says surgeons will often use a manual cranial drill.
It's a hand crank drill. This is, as old as a drill technology as we have in society. The drill bit looks like any drill bit that you would use for anything you're drilling. And we sort of position it exactly where we want on the skull. Usually we're trying to be very perpendicular to the surface of the skull. And then you basically just start cranking the drill. And it may take, in some cases, even a few minutes to get through.
Surgeons use both hands, one to hold the device in place while the other winds the crank to drill into the patient's skull. Though operating rooms are now equipped with incredible systems that can hit specific GPS points and utilize augmented reality technology, many hospitals use the manual device as an emergency bedside operation.
We have high-speed drills. We have all sorts of tools that can make this faster and safer. But in the ICU, those things are typically not available. And if they were available, it would take a lot more time trying to get things set up and get going. And so the hand crank drill to date was sort of the simplest way to do it, probably the most cost-effective way, versus having some extra equipment that you'd have to pull and set up and use to help you do the drilling.
And as we mentioned earlier, the surgeon spends minutes hand cranking a drill through bone. Sound archaic? Casey Qadir certainly thought so when a classmate in her medical device entrepreneurship class told her about the tool.
Dr. Ahmed Air, and he was the chief neurosurgery resident at Northwestern Hospital at the time, and he was getting his MBA at night. And so he was the one who told me that he uses this hand crank drill to drill holes in people's skulls like every single day. And he said, this is medieval and it's unnecessarily dangerous and there's got to be a better way. And around that same time, my grandfather was suffering from Parkinson's disease. And so I was learning about kind of the surgical interventions available to him, which rely on powered drills in the operating room that still don't stop automatically. And so here I'm learning about this world of cranial drilling without the most basic safety measure, which is auto stop.
It was in that class that Qadir and Air decided to try their hand at updating this drill technology. That moment spurred the creation of Hubley Surgical, a medical technology company of which Qadir is co-founder and CEO. Qadir has a bachelor's degree in neurology from Northwestern University and a master's in applied and computational mathematics from Johns Hopkins University. But her passion started long before these achievements, when she was just a young girl.
I was kind of seeing my great-grandmother suffer from dementia at the same time as my baby sister, like learning how to speak and watching her brain develop. And so kind of, I think the duality of brain development and also brain decay got me super, super interested in neuroscience. So I have a school assignment from when I was like 10 years old saying that I wanted to be a neuroscientist when I grew up. So
Qadir could be considered an outlier. While women make up more than half of America's workforce, the National Center for Science and Engineering Statistics report that they only represent about 35% of the STEM field. Despite the small community, Qadir says she's been lucky to have had fantastic female mentors at each stage of her life.
And I think that because I met so many, because there are so few of us, because the people that are in the space are really, that I've found are really, really supportive, and they're really happy to kind of give back to like young women that they find. So yeah, I think that it can be alienating, often being the only woman in the room, especially in these male-dominated fields, but the women that are there are awesome, and we look out for each other.
This consistent support, along with Qadir's personal ambition, has helped fuel a class project into an FDA-cleared medical device. Though the team wanted to improve the hand crank drill, they didn't want to cause any extra work for the care teams. So they created this drill as an easier, safer option that allows the staff to keep the same operating routine they've always known.
Our drill is cordlessly powered. It can be used in emergency procedures, and that power is much easier for the physician. And then most importantly, it stops automatically upon drilling through the skull. And we also have an LED force indicator on the back of the drill, which just gives the user, again, a little bit extra control so that they know how applying the correct amount of force. And then when the motor shuts off automatically, because the drill bit is conical shaped, you can't push any further. So it prevents accidental plunge into the brain via both that software and that additional hardware mechanism.
Plunging is when a device drills past the skull and down into the soft tissue of the brain. Potts says that it happens very rarely. Even though the hand crank drill doesn't have an automatic stop, it does have a little ring called a depth stop that the surgeon sets at a specific length to prevent plunging. The real upgrade he sees with the Hubley drill is its precision. Potts says that it can be tricky getting manual drills to stay where you want them.
They have a tendency to sort of migrate or kind of walk around on the surface of the skull. And so it can be off, not a lot. There's not a lot of room within that incision, but it may not be in the exact spot that you originally wanted it. It can be hard to get that hole perpendicular through the skull. And that's because as you're sitting there cranking it, your hand can kind of move back and forth. And with these drains, we're basing everything on those landmarks on the skull. We're basing it on being perpendicular through the skull. And so if that hole is not perpendicular, if it's off at an angle, that can sort of divert the trajectory of our drain and have it so that we miss the ventricle that we're trying to get into.
And as Potts mentioned earlier, a manual drill takes time. Moving faster increases the risk of plunging, so sometimes it can take a few minutes to break through the bone. Potts was the first person to perform a successful emergency procedure with Qadir's drill last October. Instead of minutes, he was able to drill the hole in just 16 seconds.
The advantages that I saw were that, number one, it was quick. It was more accurate. The way the drill was designed, once you set it down onto the skull, it was going to stay there. And because all you're doing is pulling a trigger instead of using both hands to sort of crank the drill, it meant you could really focus on keeping that drill perfectly perpendicular to the surface of the skull. I think it makes that one step so much easier that neurosurgeons who try it are going to prefer doing it that way. The reality is, again, these procedures, they're emergent. Oftentimes they're happening in the middle of the night. So the neurosurgeon who's doing that wants to get this done as quickly as possible. They want to help this patient as quickly as possible. And it really does make that one step of drilling that hole much easier.
Just like with the manual device, the Hubley drill is single use to prevent the risk of infections.
For a hospital that might do like 30 of these procedures a month, they will buy, let's say, 40 kits and then use those over the course of the month. And then as they start to run low, then they'll order more.
Now that it's being used in hospitals, Qadir says the next phase is to launch different size drill bits for various types of brain surgeries. At just 24 years old, she's helping to usher in a new generation of female founders in the medical technology space. After experiencing the power of female mentorship in STEM, Qadir's always encouraging the women around her to take the leap and bet on themselves.
I would love for more women to get involved in medtech. The women founders that I know in medtech are fantastic at it. And I think that there's so many more needs in healthcare that have yet to be met, especially with women's healthcare. And I think that having more women innovating and more women identifying these needs is only going to make our healthcare system better.
You can find more information about Casey Qadir, Dr. Matthew Potts, and all of our guests on our website, radiohealthjournal.org. For more behind the scenes, follow Radio Health Journal on Facebook, Instagram, and X. Our writer-producer is Kristen Farah. Our executive producer is Amira Zaveri. I'm Elizabeth Westfield.
Coming up next week on Radio Health Journal.
We need to recognize that health is a means, not an end. You don't live to be healthy. You're healthy so that you can live.
Did public health become too visible during the pandemic?
But first, why we need to diagnose endometriosis earlier in women.
Giving a person a diagnosis is all about validation and making them feel like their pain is something that's really important and we need to fix it. It's not just something in their head.
All that and more on Radio Health Journal. I'm Elizabeth Westfield, host of Radio Health Journal. If you enjoy listening to Radio Health Journal, you'll also like our sister show, Viewpoints, which covers a wide array of topics from education to history to the environment. Here's a preview of what they're covering this week on Viewpoints.
The sunlight gets weird. You can feel things changing. The birds are going crazy.
The rare cosmic event coming up soon that you don't want to miss. Then,
to think that Russian athletes are held to the same standard as other athletes is incredibly naive and frankly foolish.
Russia's long history of cheating at the Olympic Games. I'm Marty Peterson.
And I'm Gary Price. These stories in depth this week on your public affairs magazine, Viewpoints.
Listen to Viewpoints Radio on Apple Podcasts, Spotify, or wherever you listen to podcasts. Thank you for joining us this week and every week as we break down the science stories you need to know. You can find all of our past segments and guests on our website, radiohealthjournal.org, or wherever you listen to podcasts. Follow us on Instagram, Facebook, and X for daily content, and tune in next week for another edition of Radio Health Journal.